When I was getting ready to do the podcast, I decided I needed to put together some boundaries in what I would do and how I do it and everything like that. So one of the things I decided that when I talked to veterinarians, I wasn't going to dictate what they had to talk about. I was going to let them talk about whatever they wanted to. I just wanted to make sure they were informative, entertaining, or just crazy cases, whatever they were. So let me set the stage for today's episode. Now, you know how when we go to the doctor's office, either for ourselves, our kids, or our animals, generally it's costly. Now, today, Dr. Abel Lera joins us from Heron Lakes, Florida. Now, I had no idea what he was going to talk about, but he started talking about pet insurance. Now, hold on. I'm sure you're thinking, oh my God, this is going to be boring. Insurance? Well, you're in for a surprise. Pet insurance can be really way more interesting than you think. So just trust me on this. This episode is going to be really worth listening to. So hang in there. We are supported by PrepVet, providing stem cell therapy for pets.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FURREALPODCAST, covered by most pet insurance.
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange. Losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Hey, everybody. Thanks for getting back with us. It's Mark Kyle again with the For Real podcast. I have a really great guest today. If you're a Gator fan or you're a Bulldog fan, you're really going to enjoy him. I've known him for quite some time. He's practices down in Heron Lakes in Florida, Dr. Abel Lera. And Abel, thanks so much for joining. I'm so excited to have you on here. I know what a great vet you are, and I can't wait to hear what you got to tell everybody. So welcome to the show.
Mark, thanks for having me on. I really appreciate it. And, I appreciate all the help that you've helped me with my patients in the past and the patients that I continue to help in the future. So I want to say, on this podcast, when you asked me what was something that I think is very important for pet owners to know about, and I would honestly say pet insurance. Before you roll your eyes, as a client thinking that this is some sort of sales pitch, as of right now, I have zero to gain from you getting pet insurance unless you actually come down to South Florida and decide to be one of my patients. So pet insurance for me, when I first started practicing about 15 years ago, wasn't what it is today. And the reason I went down this path of being an advocate for pet insurance is because as a veterinarian, being somebody who wants to offer the best medicine possible, a lot of times people want the best medicine, but there's this gap between what people want in terms of the quality of medicine versus what they want and or expect to pay. And so it puts both the client, the pet, and the veterinarian, the veterinary hospital in an awkward and precarious situation where people want a certain level of care and the pet needs certain tests and or treatment. And yet there's this chasm between what they have the ability to pay for and what is necessary to pay the animal hospital so that we can take care of the patient, take care of our staff, take care of the veterinarian. And so some people might say, well, vets are out to make money and all that kind of stuff. And what I would tell you, not so fun fact, is that veterinarians are either the number one or number two career that have the highest rate of suicide. And this comes from, I think, a number of different reasons. One is the fact that we actually have access to drugs that can assist us in that process, which is, unfortunate that some people feel the need to go ahead and go down that path. Another aspect of this is that we as veterinarians have not really valued ourselves in what we help people with. And so, we go ahead, we think, oh, okay, well, I don't feel comfortable charging this, or I don't feel comfortable charging that. And so I got into that situation where I felt bad. The client was upset. It's going to be a lose-lose situation, where the vet doesn't charge what they need to charge. And how is that a problem? Well, that becomes a problem because if it happens once, then it continues to happen again and again and again. And then this veterinarian that you think is the best veterinarian out there because they do great medicine, they take their time with you, and they don't charge what you consider to be exorbitant prices, they end up retiring after 8 years or 10 years, or they just switch fields, or they get out of private practice because they're just burnt out. And this is the same thing that happens with the veterinary technical staff. They'll go ahead and they will be giving their all, and they just get into so many of these situations where the pets aren't able to get the care, or they have to sacrifice what they're getting paid, and then they're not even living paycheck to paycheck. They're living in debt their whole life. And then they end up having to either switch industries or leave private practice as a result of burnout and or lack of being able to live at the level that everyone should be able to live at. And I just saw a very interesting fact or statistic. I don't know if it's true or not, but I want to say in the 1950s or 1960s, the average income was half of what the average cost of a house was in the United States. So let's say a house cost, I think the number was $11,000 back in the 1950s. The average household income was $5,600 a year. Nowadays, the statistics say that the average household income, I think, is something like $50,000 or $60,000 a year.
I think it's 60.
Yep. And the average cost for a house is $300,000. So the disparity between what people are making versus their ability to pay the expenses is getting bigger and bigger. And so how does this tie back to pet insurance? So for me, what I have decided was I'm going to utilize pet insurance to help my staff as well as to help my clients and my patients get the care they need and deserve, and also to go ahead and help those clients that want to provide that care for their pets without the stress of having to worry about where the money is going to come from, without the uncertainty of having to have that money aside all the time, and the stress of uncertainty of how much money they need to actually have. And so this is a process or a journey, I would say for sure, because for me, I started off, I'm not going to mention specific companies in this particular podcast, just because I don't know if I can get into any sort of trouble or anything like that. But I started off.
I'm always in trouble.
Yeah. Well, I put videos on YouTube. This is not a plug for my channel. If you want to go on there, you can check it out. But otherwise,
yeah, please do.
If you just search Heron Lakes Animal Hospital on YouTube and Instagram and TikTok and Facebook, you can find us there. We have a library of videos talking from a range of different topics. And I'll probably start coming out with a Dr. Lera channel as well, where I'll be talking about some of the ways that I take some of my personal philosophies and bring them to veterinary medicine and practice, whether it's my spiritual beliefs in Jesus, or if it's the sustainability and the zero waste, trying to take care of the planet and steward the planet that has been provided to us. Some things and some stress relievers as well. But on that channel, I made a video about some insurance companies that I recommended, what they cover, what they don't cover, and one of the videos, in that video, I got a cease and desist order from an insurance company that I needed to take that down because I wasn't a licensed insurance person.
Oh, that's ridiculous.
Yeah.
That's so ridiculous.
And so my social media guy and I were looking at it, and we were looking through the comments, and we just saw that this X particular insurance company was getting a lot of negative comments, even though I had recommended that company at the time. So that's really the only thing that we could have deduced, because that video was up for a few years before I actually got that cease and desist letter. But going back to it, things will change. What I have also noticed is that I've seen it when been in car accidents, and the repair shop is like, oh, which insurance company are you using? And I'm like, insurance company Y. And they're like, oh yeah, they're easy to work with. And so I was like, aha. So this is not just in veterinary medicine. This is not just in human medicine. This seems to be across the scope of all insurances and industries, where some companies are easier to work with than others. And so initially there was one company that I recommended. They ended up becoming really expensive. They started getting cute with different claims, asking for things that no other insurance company asked for. So I stopped recommending them. And then the other thing for me is it makes things so much easier. Like when I tell you, hey, look, your dog's going to have to be on, I don't know, medication that retails for $200 a month. And, oh, by the way, your insurance covers 90% of it. I mean, now you're talking about $20 a month. That's a huge difference.
Let me interject a little bit, Abel. First off, for listeners out there, we didn't know what we're talking about today. So this is actually a great surprise. I'm really glad you're talking about it for many reasons. One is that most people have the perception of insurance from the human side. So you got your own medical insurance, which is really expensive, car insurance, whatever that is. Pet insurance, and I'm not promoting any brand whatsoever, pet insurance is really inexpensive. And based on what I do in the industry, it really helps people get provided with something that they may not have been able to afford to do. Exactly what Dr. Lera is saying. So listen to what he's got to say, because this is important. It's not expensive. Don't think of it as like your medical insurance for yourself. For animals, it's so inexpensive. It's crazy not to get it.
So what I would tell you this, obviously it all depends on who you're asking, because some people will consider $20 a month expensive, and then some people will consider $85 or $95 a month not expensive at all.
Right.
So, for the people that are listening, it's what I typically tell people is this. Odds are, if you're listening to this podcast, you're going to want to get it because you're interested in all things pets, and let's change that term pet to, or label to, favorite family member, not even a furry family member, but favorite family member.
Oh yeah.
Because, these are the pets, and I tell people this all the time. My wife complains, and myself, and we complain to each other sometimes about, like, we treat our pets better than we treat each other. And I came to the realization, I said, the relationship between pets and humans is completely different. The relationship between pets and humans is simple. If my dog poops in the middle of the living room, I'm going to be like, oh, sweetie, you don't feel well, or I'm sorry, I didn't let you out. If I poop in the middle of the living room, my wife's going to be like, what did you just do?
Exactly.
And that's putting it mildly. And I would understand why too. And so that just gives you like a clear-cut example of, the difference in the relationships and why it is. Because they are as close to the love that God provides to us as can be. Other than just God, that's as close as it's going to get. If you yell at them, they come back, they apologize to you. They're always excited to see, well, my pets are, they're excited to see you as if like you've been gone for, weeks or months at a time, even if it's only been for minutes. They're there for you when you're stressed. They know it. And they just have this intuition. And I've heard somebody say something along these lines, that we are privileged to have them in our lives. They are not privileged to be in our lives. They are not privileged to be in our lives. We are privileged to have them in our lives.
Completely agree.
And so, going back to pet insurance, for me, what I would tell you is this. I typically tell people, I recommend that people get like 90% reimbursement with a $500 or $250 annual deductible. And that variation has to do with whether or not it makes financial sense to go with the $250 deductible or not. And what do I mean? So I'm going to use some easy numbers. Let's say that the cost for the premium at whatever the cap is with a 90% reimbursement at $500 is going to be $25 a month. Okay. And your premium, and then what ends up happening is if you increase it, let's say if you increase the deductible to 500, did I say 500 or 250, Mark?
You said 500.
Right. So let's say you decrease it to $250. So that's a $250 difference. Let's say it goes from $25 a month to $45 a month. That's 20 times 12. That's 240. It's pretty much a wash.
Right.
So whether you go with the $500 deductible or the $250 deductible doesn't really matter. But there are some times where if you get the lower deductible, it'll only be like you'll be paying an extra $100 a month in difference. So let's say you go from 25 to like I think it's $8 more a month, so we put it up to $33 a month. So now you're paying an extra $96 a year, but you're getting $250 less in deductible. So that actually does make sense. One of the other things that I would say is that 80% of things that can happen to your pet in 1 year will be covered by $10,000 a year in coverage. What do I mean by that? Like if your dog tears an ACL, if your pet has to have oral surgery, if they have to be hospitalized and then have to have multiple tests, that's about, you're going to have about 80% of things that will be covered by $10,000 a year. $20,000 a year of coverage will cover about 90% of things, and $30,000 a year will cover about 98 to 99% of things that can happen to your pet in 1 year. So I give people those spiels. I personally have unlimited policies on my pets. I don't tell people to get unlimited policies because A, I don't know their financial situation, and B, I don't want them to feel like I'm trying to upsell them on insurance so I can run up the bill. I give them those percentages so that way they can go ahead and they can choose based on whatever their comfort level is and how much uncertainty they're comfortable with. Some people, they don't want any uncertainty. So they get an unlimited policy and the top tier policy and the most comprehensive coverage regardless of cost. Other people, they're comfortable with more uncertainty and they'll say, you know what, I'm going to go with $10,000 a month, $10,000 a year, and probably be fine. And so what ends up happening, and people end up selecting that. One of the other pitfalls that I find is that when people bring me a young animal, they'll say, oh, you know what, I don't need that much coverage, or I don't need it as of right now. And so there's two issues with that people may not be familiar with. One is that there is something called pre-existing conditions in pet insurance. And so what does that mean is that if your pet has shown any signs or symptoms or received any sort of treatment whatsoever for said condition, some insurance companies will consider it pre-existing for the rest of their life. Other pet insurance companies, they have a clause that says curable or non-chronic condition. And they might say, hey, if your pet goes 180 days, not 6 months, because I've had certain insurance reps tell me it's not 6 months, they're very specific, 180 days without signs, symptoms, or treatment, and it's not considered something chronic like diabetes, they'd say, hey, we'll lift that as a pre-existing condition. So I tell people, get the pet insurance on them as young as possible, because that way you'll have as many things covered as possible instead of, oh, well, now they're 6 years old and they've had ear infections and diarrhea and vomiting and they were limping on a back leg. And now like all these things are not covered. And you're like, come on, bro. Like, so that's one of the things for young pets. The other thing that I would tell you is start with a higher limit rather than a lower limit. Why? Because the way that the insurance companies have it set up, as of right now, we're talking August 15th, 2023. If you start with a lower policy, and let's say something happens where your dog has to have surgery or a cat has to have surgery, and you blow through your cap, and you're like, holy cow, like that was I wasn't expecting that. Let me increase it from 3,000 to 10,000. You have to cancel your current policy, start a brand new policy, and any of the stuff that happened beforehand could potentially now be considered pre-existing for the rest of their life. Versus if you start with a higher policy and then say, hey, you know what, I got to cut back on costs, you just reduce the coverage, but you still have all the same conditions covered. So that's one of the things I tell people, when they have young pets, get it as soon as possible. And so the other thing that I would tell people is that there is typically a 14 to 15 day waiting period for most pet insurances. And that's something that you need to keep in mind when you're bringing your pet in. When you get a new puppy or a new cat, or you adopt a new dog or cat, don't switch the diet. Don't add any new treats. Keep everything the same. because if they end up having vomiting or diarrhea or not feeling well, and you bring them to the vet before that 2-week window passes, it is now potentially considered a pre-existing condition. So keep everything status quo, and that can help you increase what will be covered by your pet insurance. Before I continue on, because this is something that I am very passionate about, Mark, do you have any questions for me?
No, I'm good. As a matter of fact, you know, because I have a little bit of experience dealing with pet owners with with the stem cell thing that we do, is I'm very well aware of pet insurance. I didn't know about the 180-day thing. I think that's interesting, first off. And I know that just because I pay attention to it, is that the pet insurance business is growing faster than any other insurance company there because one is during COVID, everybody adopted pets, so the market's grown significantly, and people are becoming more and more aware of the value of actually having pet insurance. So I'm really glad you're talking about this. I absolutely had zero idea we're going to talk about this. So it's interesting to me as well because I'm a pet owner as well, and I'm dealing with pet owners myself. So I think this is great. Let's stay on topic. I think it's wonderful.
So one of the things it is, I do hear that it is growing at a relatively fast rate. The crazy thing, and I think the reason that it is growing at a fast rate is because you have a lot of millennials that don't necessarily want to have kids as of right now, or like two-legged kids. And I'm not talking about birds. And the other thing is that there's a huge pool of pets in the United States. I want to say it's something like 250 million to 350 million pets in the United States. And if you had to guess what percentage of pets are insured, what percent would you say?
Well, I think I know. It's like a 3.5% or something like that, right?
Let's see. I think it's less than 2%. Pets.
Oh, really?
Yeah, let's see. Pets insured currently in the United States. And so I think that's one of the reasons why it is that they're jumping in on it. Let's see here. This is highlights from North America Pet Health Insurance Association 2022. Pet insurance in 2022, 5.3 million, up from 3.1 million. Dogs continue to make up the majority. What percentage of pets have a pet insurance? So this was I'm not getting a quick number here, so I'm just going to go ahead and stick, probably between that 2 to 3.5%.
Yeah.
But yeah, it's something where I think that's why it's growing so fast.
It's a good deal. I mean, bottom line is it's not that expensive. Again, like you mentioned earlier, it's relative on what your cost availability is. But when you go to a clinic, if you've got any kind of dogs or cat, there's something that's going to happen, and you'll get your money back fast. And I'm not advocating for insurance because I don't have anything. I'm not associated with it at all. I just know that it's a good value. It's a lot better value sometimes than your own medical insurance for yourself, personally.
Yeah, I think there's less issues with getting reimbursed, and that's one thing that I would tell people is all pet insurances, their primary go-to is to send a reimbursement. It is not for them to pay the veterinarian directly. There are a few companies that do offer that service. Currently, we only accept direct payment from one of those companies just because they have a good history and they pay out pretty quickly. But, in human medicine, I think it's something like a month to 2 months or maybe even 3 months that healthcare providers have to wait to be reimbursed. And so for me, it's something where, I always let the clients know ahead of time, hey, this is what you're looking at. The other thing, it's going to depend. Some people will say, well, what if I don't have, Dr. Lera said, it's better to get it while they're younger. Is there an age that the pets are too old? And what I would tell you, the short answer is no. There's not an age that pets are too old. But you do have to recognize that pet insurance will become more expensive as they get older. And it's just like what it is with us. And so
for human, exactly.
What you have to do is before signing up for the pet insurance, you can have somebody, review the records and see kind of what would be considered pre-existing or not be considered pre-existing. And, like I do that for my clients. Sometimes I'll say, hey, let me take a quick look, and I'll look. But that's somebody that, I have a lot of experience with pet insurances. So I'm able to a lot of times be able to advise people on that. And, and I tell people it's something where, yeah, my practice definitely benefits from people having pet insurance, but that's not why I do it. It supports the overall well-being, not just of the business, but of the people who are here providing care for the pets. And if, people are like, oh, I want you to stick around, this, that, and the other, blah, blah, blah. Well, if you want us to stick around and you don't want to be selfish and you care about us the way that my staff or my team and I care about our clients as well as our patients, we're going to have to charge certain fees. I mean, I see it in the rooms, I'll be 30 minutes behind and a client's complaining and they're coming in for a free second opinion. And then I go ahead and I go into the room and I can't get the client to shut up, and not shut up because, they're annoying, but because they have so much information that they want to talk about. And I'm guessing, I could be wrong, but I'm guessing I'm answering questions for them that have not been answered by other people before. And if they have been answered before, it hasn't been with the detail or from the perspective that I'm offering it. So, pet insurance, again, for me, it's also something where people will say, oh, you know what? It ends up being a wash, or maybe I lose some if I end up going ahead and get the pet insurance versus if I just pay it all out in the 2 or 3 times that they get really sick. And I tell people, I used to be afraid because I guess I didn't have enough statistics and experience to be able to speak to it. Now what I tell people is you're wrong. And I tell them the reason that you're wrong, if you value your pet as your favorite family member, you definitely come out on the winning end. And this is an example. What ends up happening is, worst case scenario, it's a payment plan. It's a 10 to 15 year, hopefully not a 5 or 6 year payment plan, because that means that your pet got sick, unfortunately, at a very young age, for all the expenses that your pet is ever going to have. Or let's not say ever, because most pet insurances, heads up, do not cover preventative things like vaccines, heartworm prevention, flea and tick, teeth cleanings. If they do, they typically have a schedule of fees. So they might say, hey, we'll give you $150 a year for cleaning teeth versus, we're just going to cover 90%. There used to be a policy out there that did cover, after the deductible, just a flat percentage. But now, to my knowledge, there is no company out there that does that. So that's something else to take into consideration. But for me, what ends up happening is this. I was down on vacation in the Keys, and I was talking to this guy, and he said, oh, he helped me out. So I said, hey, how can I repay you? Do you have a pet? If you ever have a pet and you want me to consult, please let me know. So he said, yeah, actually, now that you mention it. And so I went over there, and he was asking me about this mass on the dog's back, and, I was talking about it growing. And so I told him, I said, well, let me do my exam. So I go ahead and I do my exam. As soon as I lift the lip, I notice the dog has a fractured canine. Fractured, just in case for those people that are listening that don't know what that means, it's broken. It's broken like halfway down. I'm not talking about a chip, like, oh, maybe it's going to cause a problem or not. No, I'm talking about halfway down. The root canal is exposed. And people are like, oh, my dog's acting fine. Just because your dog is acting fine does not mean that they are not in pain or uncomfortable in some way, shape, or form. So I said, well, by the way, this needs to be fixed. And, whether you do a root canal or extract the tooth, that would need to be addressed. And so then I said, and he told me how old the dog was. And I said, well, does your dog have a heart murmur? He said, oh yeah, you know what? The dog does have a heart murmur. And I said, okay, well, like if you were at my office, I'd say you need to do x-rays. X-rays are, a few $100s. And then if you're going to do an ultrasound on the heart, you're going to need to go ahead and do that. That's going to be another few $100 to $1,000. And so he was like, yeah, so I just decided just to kind of put it off for right now. And so what ends up happening is those things that you put off because you don't have pet insurance, if you're paying 10 cents on the dollar, you're like, hey, let's go ahead and do it.
Right.
Somebody told me one time, pet insurance helps people make medical decisions, not financial ones. And so that's where people are like, oh yeah, it ends up, I end up losing money on it. No, you don't end up losing money on it. You end up using it. And then the insurance is like raising your rates. They say they don't raise their rates based on how often you individually file claims. They say they raise their rates based on, let's say you live in Florida and you have a Rottweiler, how many claims they get that year in the state of Florida with Rottweilers. And that's how they raise the rates.
So just to interject real quickly, and it's a little off subject, but I think it's a little zinger for you. So you're talking about root canal. Did you, before you went to vet school, did you realize how much you're going to be a dentist more than anything else? It's amazing to me how many vets are treating animals, their teeth all the time. I don't think anybody out there as a pet owner realizes how big of a business that is for you guys.
So in vet school, they don't really, at least when I went to vet school back in between 2004 and 2008, we had an elective for dentistry. So we definitely don't get educated enough on dentistry. And so if I had to go back to my past self and say, hey, this is how much dentistry you're going to be doing. You need to like get into this. No, you'd blow my mind.
Yeah.
And it's just because, not because veterinarians are bad at what they do, but because, it's like, I don't know, it's like being on your screen, on any sort of electronic before you go to sleep. Those kinds of blue lights affect your sleep, and the word is getting out. Now we have like the night protection thing where your screen goes from blue to orange and that kind of stuff. But there really isn't a whole lot of information out there in regards to dentistry and that kind of stuff. And I used to try and do this stuff. Initially, I would just go ahead and just like remove like whatever teeth were loose. And then I realized that I was missing a lot of disease as I went to continuing educations. So then I started doing dental x-rays. But again, even like if you're just learning, you don't really like, you're not able to identify everything that's happening, or the majority of things that are happening. Because fun fact, 70% of the disease that goes on in your pet's mouth happens underneath the gum line. What does that mean? That means, translated into layman's terms, we will have no idea what we're truly getting ourselves into until your pet is on the table under anesthesia and we've done x-rays on the whole mouth, not just on that one tooth that is fractured or looks infected, and we've probed everything. And then on top of that, you got to have somebody who is skilled at being able to interpret those x-rays. And I say I used to do oral surgery myself because it happened to me twice while a patient was under anesthesia, where I did x-rays. I had an idea of what it was I needed to do, but I was too scared and not comfortable in my skill set to be able to perform the procedure that needed to be performed. And Holy Spirit said, I got your back. Call the oral surgeons that you just started working with not too long ago. They're going to come in here and save your butt. It took 2 times for me to then make the decision moving forward. I am not doing oral surgery with x-rays anymore. I bring dental experts in who they do oral surgery multiple days a week, multiple times a day. And so if there is some sort of situation where a curveball gets thrown at them, they knock that thing right out of the park. Versus for me, it would be something I'd be scared to do. And then it's like, even if I do identify it, do I actually do the best thing for the patient, or do I do my best? And that's one of the things that I really, for me, I go ahead and I say, hey, I'm comfortable telling you I don't know. And I also know a lot of the times I'll be able to tell you if it's somebody who comes to my practice or somebody that I send you out to, they do know. And I think that's one of the things, as healthcare providers, whether it's medical doctors, dentists, veterinarians, whatever, that people look up to us and expect us to be perfect, and we're not. We're just humans. And the part of it that's hard is if we make a big mistake, and I say we as healthcare providers overall, the consequences are bigger, potentially. And so we have this fear now.
There goes my dog.
Yeah. We have this fear of having to be perfect. And so then we as healthcare providers start to try and create this barrier of protection against litigation. And so now people don't necessarily want to be as transparent. They don't want to take responsibility because they're afraid that they're going to get their pants suit off and lose their license, and also potentially get just slaughtered online. And so, one of the things that I do is I just say, hey, you know what? This is out of my wheelhouse, but you know what? I know somebody whose wheelhouse this is in. And so I've stopped, now I just kind of tell people, hey, by the way, you have 3 dentistry options. You can do a non-anesthetic cleaning, which is only good for, maintenance and slowing down periodontal disease and that kind of stuff. We can do a cleaning with general anesthesia for those pets that are too nervous and or painful. And if they are painful, then at that point, they probably need dental x-rays. And so I offer people, hey, look, we're going to do the cleaning with anesthesia and we'll remove any teeth that are loose, but we're not going to do x-rays because I don't want to feel like I did x-rays and I underserved you by not knowing what I was looking at. And then we offered, the 100% complete and meticulous examination of the mouth, where we bring the dental experts in and they do the x-rays, they figure out what needs to be done, and we go ahead and take care of it on that very episode of anesthesia.
Well, I think as a pet owner, and all the listeners out there, all pet owners, I don't think we ever think about, oh, my dog or my cat's going to need dental work. You don't think about it. It's just not a thing you think about, at least for me. I mean, I'm sure you see it all the time, but as a pet owner, that's the last thing I'm thinking was going to happen to my dog. I'm thinking something will happen to the leg or some other weird thing, but you never really think about the dental work. But it always surprises me when I've been in vet clinics, almost 80% of the time I'm in there, there's somebody in there doing some dental work. They're cleaning the teeth or doing something. It blows my mind how often you guys actually have to do that.
So while you were just saying that, I just looked up a stat, and it says diseases of the teeth and gums are common in cats. Studies report that between 50 to 90% of cats older than 4 years of age suffer from some form of dental disease.
Yeah.
But fortunately, the most forms of the disease are largely preventable or treatable with appropriate monitoring. And then if I put this for dogs, I'm curious to see here. Dogs. It says periodontal disease this is coming from Cornell's vet school.
Mm-hmm.
Periodontal disease is one of the most common health issues in veterinary medicine. Even if your dog's teeth look pearly white and clean, studies show that 80 to 90% of dogs over the age of 3 have some component of periodontal disease. It's much worse in smaller breeds, and the incidence increases with age. So that is probably the most common disease that we see in veterinary medicine is dental disease.
I know. And it's not, I mean, if you think about it, you get it because you see it all the time. But as a pet owner, that's the last thing I'm thinking about is their teeth. Last thing. I am now.
The thing is, people are like, oh, but I get their teeth cleaned, or I got their teeth cleaned 3 years ago. And I'm like, you got their teeth cleaned 3 years ago. Okay, let's put this into perspective. Let's assume you have a smaller breed dog that ages slower than you do, than a big dog. So 1 human year is equivalent to 5 dog years. And it's been 3 years. So now let's just multiply 3 times 5. That's 15. So assume now you're not brushing your dog's teeth. So assume you go 15 years without brushing your teeth, 15 years without seeing a dentist, 15 years for somebody who's prone to periodontal disease. And oh, by the way, you're probably chewing on things like rocks or hard toys or, things that are damaging the enamel of your teeth that make you more prone to dental disease. Tell me that you don't think that your dog's going to have a jacked up mouth.
Yeah.
And when I tell people that, they're like, wow, they're flabbergasted. And it was interesting, we call it private practice, or practice of medicine in general, again, across all fields. I used to think that if the pets got their teeth cleaned regularly, that would stop the disease. And I learned that was not the case. Obviously, based on what I just told you, you can see why that just getting the teeth cleaned every 6 months, multiply that times 5, let's say half a year, 2.5 years, without going to a dentist, getting your teeth cleaned or brushing your teeth. But the other thing is, I probably have maybe less than 5 people who come to my practice or have come to my practice where they diligently brush their pet's teeth every single day.
I don't. I don't. I guarantee I don't.
Nor do I. And I have an almost 11-year-old poodle mix. Her name's Ginger. If you guys check us out on social media, you'll see her on some of our videos. She's going to be 11 in November, and she just recently, I think, had her 4th oral surgery, and she had 15 teeth removed. And so, the thing for me is recognizing that patient, hopping back to the client that brushed the dog's teeth every day, she had one little tooth that was gray up front, and I said, "Oh, that tooth," and it was loose, and I was like, "Oh, that tooth's got to come out." And so we went ahead, we did X-rays. Mark, can you guess? And the gums from the outside looked spectacular. It didn't look like there was any other issues going on, but we went ahead and we did X-rays just to make sure on the whole mouth to make sure we weren't missing anything. You want to guess how many abscesses we found in that dog's mouth?
I have no idea. Tell me. I almost don't want to know.
I want to say it was like 12 to 14 teeth.
Oh my God.
And the client was flabbergasted. She was crying on the phone, and I knew it when the oral surgeon was doing the X-rays. I was like, "Oh no!" And that's putting it professionally because that's not what I said.
I
Um,
know exactly what you said.
and, and I was like, "Oh my god, this woman's gonna have a meltdown." Oh my god, and and so after talking her off the ledge, which understanding, again, thinking that you're just going to have one, maybe two teeth removed because there was one tooth all the way in the back that the company that does the cleanings without sedation identified. Okay, fine. But to go to 12 teeth, especially with the mouth looking the way that it was, I mean, it was crazy. And so I would like to say that I don't get shocked when I see stuff, but I definitely still do. So it's something where, for me, I am shocked at the amount of the amount of dental disease that we do, and it's helpful, and I think it's critical to have somebody who really knows what they're doing when they're looking at your dog's mouth, so they're not doing their best, but they're doing the best for the dog.
Yeah, and so everybody that's out there listening, so this is a great lesson to think the next time you have your pet in there. I'm assuming your vet's probably looking at, but maybe ask them to check their teeth just because of that. My daughter has what we call a Chewini Patrick. He's like 14 years old now, and he's just got like one snaggle tooth left, and he's so bad. He's so old, anyways, but his tongue hangs out all day because there's no teeth to keep his tongue in anymore. It's terrible, but it's pretty funny too at the same time.
Yeah, and and now that kind of circling back to what we were initially talking about, which was pet insurance, one of the things that you have to also realize, and if you haven't already gleaned it already from the conversation so far, is that not all pet insurances are created equally, and not all pet insurances are going to serve all pets the same. And they're not going to be the best for certain pets or this, that, and the other. They all have their pros and cons. And so one of the things that I tell people is if you have a small breed dog, like let's say 15 pounds or less, you're going to want a pet insurance that covers periodontal disease. And you want to make sure that they cover periodontal disease up to what your annual cap is. Some of them will put, if they even cover it, because some of them don't cover it at all, they'll put $1,000 cap on that. And I tell people, I'm like, $1,000, unless if you're having like a technician remove the teeth, okay, that might be a decent amount. But otherwise, if you have an oral surgeon working on your dog, you're going to blow through $1,000 really fast on periodontal disease.
Hey, let me ask you a question. So when you're talking about small dogs having more, what about cats? Do they have the same amount as a small dog, or is it different?
So I wouldn't say that cats have as much periodontal disease as dogs. What they do is they develop something called a resorptive lesion. And the closest thing that I've heard the oral surgeons kind of equivocated to in human medicine is a cavity. The main thing as of right now is that the difference between cavities and the resorptive lesions is that the resorptive lesions, to our knowledge, there's nothing you can do to prevent it from happening. And you can't go ahead and put a filling on it. It's something that does require actual extraction. But that is actually the most common disease that happens in cats. That's usually not considered periodontal disease by the pet insurance company. So that's something to keep in mind. Something else that I typically tell people is if you have a larger breed dog and you're already like beyond a year of age, there are some pet insurance companies where, because a lot of pet insurance companies will have a 6 or 12-month waiting period, ACL injuries, that's like if your dog tears a ligament in their knee, and also hip dysplasia.
Wait a minute. So if you have a torn ligament or a cartilage torn, you've got to wait 6 to 8 months to get it treated?
No, let me provide some clarification on it. Thanks for asking that question so that way I can clarify it for you.
Okay.
If you sign up on January 1st of 2023 and your dog tears the ACL on May 29th of 2023, and your policy has a 6 or 12-month waiting period, you're out of luck.
Oh, I got you.
And on top of that, because there is a up to 40% chance that your dog is going to tear the other ACL on the other leg, regardless of what you do within the next 18 months in some breeds, they are not going to cover the other leg. It is automatically going to be considered a pre-existing condition for something what they call a bilateral exclusion. Okay. I can think of one pet insurance company. I'm not going to You know what? I'm gonna go out on a limb. I'm gonna say it. The name of the company is Embrace.
Uh-huh.
They have an orthopedic exam that you can do where they will waive their 6-month waiting period. If your veterinarian, obviously this is not for the shady characters out there trying to take advantage of pet insurance companies, which don't get me wrong, and everything's a business, and the pet insurances, on my belief is they're out there to make money.
Of course.
And if they happen to help pets in the process, so be it.
Right.
So don't think that I have pet insurances are the best thing in the world, and it's all rainbows and unicorns and butterflies. No. I know there are rules to that game, and I familiarize myself with that game more and more.
They're an insurance company. We all know what an insurance company is, but as insurance companies go, it's the least expensive one that I'm aware of for treating some things. But sorry to interrupt.
Yeah, no, that's one of the ones, if not the one that I usually guide people towards for larger breed dogs, for larger breed dogs, and I'll leave it at that, and also for pets who are older than a year or two, because they still provide pretty good coverage beyond a year, and they don't put limits on what they'll offer you. They may increase the cost, but they won't put a limit on like, oh, well, you can only have 50% coverage, or you can only have 60% coverage.
Right.
Because there are some companies out there that will go ahead and limit that after 4, 5, 6, 7 years of age. So that's one of the other things that I tell people is be aware of that. So that way you can go ahead and get that form filled out by your veterinarian so that you can waive that 6-month or 180-day waiting period.
Well, it's interesting because basically what they're saying on the back to the ligament injury, it was an ACL injury, I think is what you're talking about. But
yeah,
so they're saying that if you're going to treat one, they're not going to treat the other because it's inevitable because of a weaker side. So they'll favor that side and they'll tear it, or they're just genetically predisposed.
The stat that I think is because they know there's such an increased likelihood of the dog tearing the other ACL that they're like, nope, we're not covering that.
Right.
And the stat is, I think it's a 60% chance or 60% likelihood that they will tear that other ACL at some point in the rest of their life, not necessarily within the first 18 months.
So for the guys that are listening out there, for everybody that's listening, so if you're going to get insurance, that's something I would check, because if you've got a bigger dog, more than likely at some point, if they like to run, they may have that injury. So you may want to check on that. I think that's a really important thing to remember for sure. Or for real.
Yeah.
Let me get it right.
Yeah, I like that. For real. Good job.
Good catch.
Yeah, it just happened to work there.
Yeah.
One last piece of information, and as you guys can see, I'm kind of jumping all over the place because I didn't really know what I was going to talk about. For the people who have smaller breed dogs, a lot of pet insurance companies, almost every pet insurance company that covers periodontal disease, if your dog has dental tartar noted on the medical record, a lot of insurance companies are going to consider that a pre-existing condition, or they're going to consider periodontal disease a pre-existing condition. So what does that mean? That means if you end up a year, exactly. And so now what they will say is, if you go ahead and get your dog's teeth cleaned, or do, like let's say there's no obvious periodontal disease, and you get your teeth cleaned, they will lift the periodontal disease exclusion as, they'll lift it. Now, the tricky part of it is some pet insurance companies will say, hey, you just need to have a dental cleaning and you can do a non-anesthetic cleaning. Some companies will say, hey, you need to have a sedated cleaning, but they won't specify whether it needs to be general anesthesia versus light sedation. And then other ones will say, we require general anesthetic cleaning to lift that as a pre-existing condition. So that is something that for people who have smaller breed dogs, I really, really harp on. And then for anyone who is looking for periodontal disease coverage, you definitely want to make sure that you get the teeth cleaned, pending what the guidelines or the underwriters say.
So get it cleaned before you get to insurance or once you get to insurance?
It doesn't matter, but I would do it short. I would do it, as close as possible to signing up to the policy, whether it's before or after.
Okay.
You're going to be on the hook for the teeth cleaning because you got the dental tartar there. And if there is periodontal disease, they're not going to cover it. But if you do have a small breed dog, odds are they're going to have developed periodontal disease again. As I mentioned with Ginger, she's had 4 oral surgeries. So if they don't cover the first one, I'm not an insurance company, but I would tell you with a high percentage of confidence that they are going to cover the next one once you go ahead and resolve that periodontal.
Okay, well, I've had you on here a lot longer than I told you I was going to have you on here. So here's my question for I always ask this at the end, and everybody knows that listens. Do you have an animal joke? If you don't, I've got one.
You know what? I went ahead and I got one that I pulled up. So,
Good, perfect.
why do gorillas have big nostrils?
Why?
Because they have big fingers.
Perfect. I love that one. So I don't know if you know this, and a lot of listeners have heard me say this before. So I ended up driving a school bus so my son could go to a different school for a long time. It was elementary kids. So every day we would do kid jokes. And so I've now had this habit of doing it for everything. And that's how I got in this on the thing. So Dr. Lera, thank you so much for being on the show. You know what? I'm so glad you talked about insurance. First off, would have never thought that would be our conversation, but I think it's so important for as a pet owner to understand that most importantly. But for everybody else out there, thanks again for listening. Remember, if you've got some dad jokes or animal jokes you can send in, we'll put you on the show. If you want to record it or you want your child to record it, we'll do that. I gladly would love you to send it. Send it to Mark Kyle, M. Kyle, Kyle, at forrealpodcast.com. And again, thanks again for being on the show. I know we went a lot longer than we planned, Dr. Lera, but most importantly, everybody else, thanks for listening. For real. Have a great day. We're supported by Let's Walk, that's here to love your animals like our own.
Austin, Houston, and Denver. Let's Walk is here to love your animals like our own. From daily walks, play, in-house sleepovers, and more. Go to work, out on the town, or take a vacation knowing your pets are in the best hands. This woman-owned small business does it all. Check us out on Instagram at Let's Walk Austin, Houston, and Denver.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, listen via all major podcast streaming sites.